Jazakallah khair, Hafiz Amin, for some food for thought to realign everybody. And I think it leads us into our next session perfectly. Now that everybody's wide awake and have submitted their questions to the panel, we're now going to go into an interesting panel discussion. It will be great pleasure in first inviting our three panelists. I'll start just as Hafiz Amin was talking about the three states of going towards a lawama and mutmainna. I see Sheikh Dr. Asim Yusuf ears picked up because I think as many of you might know that we're introducing first, he's our guest speaker. He's travelled all the way from the UK to join us, Jazakallah khair. And he's actually busy with a book on Ihya Ulumuddin. Some of the more everyday people in the audience will recognize Ghazali's work in what Hafiz Amin was saying. So I'd like to introduce our first panelist, Sheikh Dr. Asim Yusuf, who's a psychiatrist in the NHS, but more importantly, he's a world-renowned scholar and ex-emeritus leader of the Muslim scholars and imams. He's got ijazah from about 30 scholars, multiple languages on 4 different continents, and he'll be part of our panel. He's a renowned poet, and like as I said, we're looking forward to his book about Ihya Ulumuddin, inshallah. Our next panelist, if you talk about bioethics, Islamic bioethics in South Africa, then we cannot fail to mention, and I think internationally also, if you study any form of Islamic bioethics, then the name that always comes up is Professor Ebrahim. He's our next panelist. Those of you from UKZN will know him. He's the emeritus professor of religious studies and philosophy at UKZN. Well known, well published. He's the consul for Seychelles as well. He's in fact published a book about the Muslims of the Seychelles, and we're really honored to have him here. If you study any form of bioethics, wherever, through whichever institute, and as you go through the search, there's 2 names that always pop up, Sheikh Shamsi Baraka and Professor Asim. And then our third panelist is already known to most of you, Dr. Yusuf, Ameer, a urologist and a robotic surgeon, and he's also completed his Alimiya course, and he's part of the fiqh of medicine. He's doing good work with halal and haram medication, and a lot of the fiqh of medicine questions and ethics questions that come up. So this is our panel. We look forward to an interesting and interactive discussion. Chairing the panel will be our president of the IMASA, Dr. Faisal Suleiman, well known to most of you, and ably is assisted by Dr. Umar Raymond, the anesthetist and convener of our convention. It's good to have these 2 here because they thought up the theme, so now they're going to have to answer the tough questions. So look forward to an interactive session, a well-curated session. Please feel free to interact with the speakers, and Faisal will chair the rest of the session.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم ورحمة الله وبركاته to one and all. We welcome you. Assalamu alaikum wa rahmatullahi wa barakatuh to one and all. They still got the breakfast on their chest. We welcome you to this panel discussion of the 43rd Annual Convention of the Islamic Medical Association of South Africa. Our session today is titled The Moral Compass in Medicine, Guiding Ethical Dilemmas with Islam, Iman and Ihsan. It invites us to pause and reflect deeply on the values that guide us, not only as healthcare professionals, but as believing Muslims. We live in a time of medical complexity, moral ambiguity, and increasing pressure, legal, institutional, and even emotional. Often we are faced with questions that textbooks don't answer, questions that cloud our moral clarity, And as Ambassador Ebrahim Rasul said, sometimes we have the moral clarity, but we lack the moral courage. In these moments, our moral compass becomes essential. And for us, that compass is shaped by Islam, the principles and laws that form our ethical foundation, Iman, our inner faith and accountability to Allah, and Ihsan, the call to act with excellence, sincerity, and compassion, even when no one is watching. I'm going to invite Faisal to introduce the beginning of our session.
Please can I ask, the ladies are all squashed up at the back there. There's so much space on my right here and in front. Can I please ask the men, if you can start filling up here in front, please come forward, fill up some of the gaps here. If you turn around and see that the ladies are all squashed up at the back there, can you please do that? Yeah, there's space in the front as well, ladies, for you. We did indicate yesterday that the women are always right, and as you enter, fill up from the right. There's a lot of space here in front. This is not a comedy show, we're not going to pick. I tried last night, but you guys didn't find anything funny. So we're not going to pick on any audience member. Please come to the front. Right. While we're settling, I just want to stress, you know, the Islamophobes, there's this, after 9/11 they used to say, not all Muslims are terrorists, but all terrorists are Muslims. Probably a bad analogy, but I want to stress this is the session today, and some of the issues that we speak about are not to disparage any particular profession or specialist and the nobility of our profession, but rather to inspire us to reflect, to think. Also, from the questions that have come in, and I'm sure the three shuyukh are going to speak to this, there can't be any clear-cut fatwas. We were having a preliminary discussion as Sheikh Asim said, you know, at the end of the day there is a difference of opinion, and often you go with the shuyukh that you trust, whose knowledge, faith, integrity, etc. However, the whole point of this is to highlight some of the issues, to speak to some of the various categories that have come through, that we all know from daily practice, also that have come through on the questions, and it's still not too late. Zakira has the mobile phone with the WhatsApp number. You're still welcome to send in questions, scenarios as they come through. So it's not to be taken personally on any, and we will come up with some scenarios because that's the point. And as Mohammed mentioned, you know, we're going to look at two or three different categories. So Zahir has introduced our three panelists. The format is going to be an opening, short opening address by each one of them, and then we're going to be looking at some of the categories. Just to broadly break them up, as you know, some are to do, the easy ones are to do with bullying, because there's some grey areas, but there's some clearly right and wrong things. The others are to do with the moral dilemmas that come up, and we'll go to those questions. And the others are to do with more fiqh issues. You know, again, we'll take those questions and you'll get some discussion. Obviously, we've set a long session for this. At the end, we are going to have you, you know, interact directly and ask pertinent questions to your own scenarios, inshallah. But we'll come to that later. So if I can ask, please at the back, as you're coming in, there's space in front just before we start, so that you're not cramped up. Thank you. Sheikh Asim.
Assalamu alaikum wa rahmatullahi wa barakatuh. Can I ask the brothers from Asim, my presentation from last night, if you could just put it up and go to probably about slide 10 or 11. Thank you. While we're waiting, Bismillah wa salatu wa salam ala Rasulillah wa ala alihi wa ashabihi wa man wala. Lovely to see you all again, mashallah, bright and early. If this was the UK, we probably wouldn't even have started yet, actually. So, alhamdulillah that you're all here, mashallah. I'm just reflecting on Brother Ameen's talk, mashallah. I've known Ameen since he was about 14 years old, maybe, mashallah. So it's wonderful, again, it's wonderful to see and hear from him. Reflecting on what he said very beautifully, actually, about the relationship between the three states of the human soul. As mentioned by Allah in the Quran, the nafsul amara, the nafsul lawama, the nafsul mutma'inna. The soul that is overcome by its desires, the soul that is resisting those desires, and the soul that is in a state of tranquility and peace with itself. These are the three stages of the human soul. Very important for me as a psychiatrist, actually, these three sort of states of nature of the human being. If you like, the soul that is earthbound, the soul that is in orbit trying to break free, and the soul that is on the journey to infinity and beyond. You might say these three states of the human soul, and how they link to the concepts of Iman, Islam and Ihsan. Particularly a beautiful insight about how the 5 pillars of Islam effectively form as effectively a type of behavioral activation. So they are, in other words, they are actions that you can perform to counteract inner-based motivations. How the articles of faith and therefore the acts of the behaviors that we are made to do on a daily basis, monthly basis, yearly basis, actually serve as a form of what is called takhalli in Arabic, which is to free oneself, to remove negative qualities from oneself. Iman, which, as Ameen says, is a higher calling on the basis of what Allah says in the Quran, and the articles of faith and constant remembrance of those articles of faith and the realities that they point to, as a form of tahalli, which is to adopt the adoption of virtuous qualities like hope and fear, like devotion and compassion and so forth, and then ihsan as a reflection of the nafs al-mutma'inna, which is a form of spiritual activation. And this, somebody was asking me earlier on at breakfast, as you have these conversations over breakfast, of which is higher, the muttaqun or the muttaqun or the muhsinun? Which one is a higher state? And it's like, well, it depends whether you're climbing Everest from the north face or from the south face. You know which one it is, but these higher states. So very beautiful and very well worth reflecting on. Because a lot of the ethical dilemmas that we are going to be talking about arise fundamentally here. They are not dilemmas out in the world. It fundamentally, when you break it down, comes back to greed versus generosity. It comes down to certainty versus doubt, and so forth. And these are qualities of the heart. And as such, ethical dilemmas faced by doctors or professionals are only specific manifestations of ethical dilemmas that every human being faces. This is something about fundamentally human nature. So the only thing I'd add to what Ameen said, since Ameen said, well, I've not got this from any shape, this is just some reflections of mine. So here's some reflections of mine. The nafsul amara, we move from nafsul amara through nafsul lawama to nafsul mutma'inna. That's the idea. Alright? In other words, from alif to lam to mim. And so my own personal, completely non-verified opinion about the meaning of alif, lam, mim, ذَلِكَ الْكِتَابُ لَا رَيْبَ فِيهِ, here is the book by which you move from the nafsul ammara through the nafsul lawama to the nafsul mutma'inna, to the soul of tranquility. None of those I was supposed to talk about, but that's just reflection while the slides are coming up. These ethical dilemmas that we face, we're thinking about a framework by which we could sort of approach this idea of bringing forth this ihsan in us. And I wanted to bring up this idea of the maqasid sharia. Just a quick show of hands, how many of you have heard of the maqasid sharia? Oh, mashallah, that's actually not bad. Right, okay. So the maqasid sharia relates to, it's what is called the higher goals of the sharia. In other words, the Sharia encompasses all of these different rulings about salah and zakat, and about trade and marriage and all of these different things. Every aspect of human activity, really. But what is the central unifying theme that brings them together? So what our ulama have done, they have developed various legal theories to explain the, if you like, the underlying workings of the Sharia. Why, what is the good, and how is it called to, and why is it good, in other words. And they came up with this framework known as the Maqasid Sharia. And it basically goes something along the lines of this. Allah is Ar-Rahman. Allah is Ar-Rahman. Ar-Rahman ala al-Arsh istawa. The All-Merciful has dominion over the throne. In other words, over the universe. But it's not Allah has dominion, it is Ar-Rahman has dominion. In other words, Allah manifests himself to his creation, inverted commas, faces his creation primarily by his attribute of Rahmah. Right? What is Rahmah entail? Rahmah entails ad-dinun nasiha, which according to Ibn Rajab Hanbali, ad-dinun nasiha means the religion is nasihatullahi fi khalqihi. It is God's wishing of that good come to creation. God's desire that good come to creation, ad-dinun nasiha. How does that manifest? In the sphere of human activity, good is defined as what averts harm and brings forth benefit to as wide a scope of people as possible. So this is the fundament of the Sharia, the highest point of the Sharia, what is called the maqsad al-a'la, the highest good that everything in the Sharia calls to is the averting of harm in dunya and akhirah from as many people as possible, and the acquisition of benefit in dunya and akhirah from as many people as possible. In other words, in medical terms, it is non-maleficence and beneficence. Right? 2 of the 4 fundamental principles of medical legal ethics. First do no harm, then do good. In other words, okay? How do we determine what is the good that we are seeking to acquire, or that the Sharia seeks for us to acquire, and what is the harm that it seeks to avert from us? And this breaks down into what are called the maqasid al-Sharia. In other words, the Sharia comes to preserve the right to life and health, to faith and the ability to know God, to intellect and the ability to learn, to family, to preservation of lineage and family bonds, and therefore of community, of wealth, property, and therefore a sense of safety and security, and lastly, to dignity. These are what you might call universal human goods. This is what the Sharia aims towards. And this discussion today, keep this framework in mind. Okay? This is not, by the way, this is not a conference of ulama, this is not how law is devised. There is a separate process of the derivation of law, what is called istinbat al-ahkam, but this is a very useful explanatory framework for all of us. When you approach these ethical dilemmas, approach them from this perspective. Does this thing seek to preserve these universal human goods, these universal aspects to which the Sharia calls? I'll leave it at that. I won't say anymore. Barakallahu feekum.
Jazakallah, Asim will next call upon Maulana Sheikh, and as all of you know, Dr. Yusuf Ameer, maybe to deliver his opening address.
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين. As you've already judged, I'm the junior member of this esteemed panel, so I'm looking to obviously absorb as much as I can from my panelists on both sides. But a little I have to say in terms of the introduction to this important, I think, panel discussion. And as the Sheikh had mentioned and Faisal had mentioned, that we are here to have an open discussion on issues that we may not find necessarily a fatwa, but we've opened the door to discussion, which has been something that always we as medical practitioners were lacking, this communication between the 2 great schools of knowledge, the school of Tib and the school of the Deen. I know much has been spoken about the soul, and the spiritual self. But I think without touching on it, we lose the essence of us being human beings. And I think as medical practitioners, people who have been trained in a very Western mode of teaching, we begin to engage in the world such that we become desensitized to our more important part. The more important part of our being is the spiritual part. You must remember, we come from a phase in a life where we call it Yawmul Alas, where Allah subhanahu wa ta'ala addressed you and I, like we are congregated here today, on a day in the realm of the souls. So we existed from past infinity. We've come for a temporary period in this dunya, and then we will exist in this realm of souls for post-infinity. So it's very important to emphasize the importance of the inner self and the soul. I like to use this analogy, and I don't know if there's any cardiologists in the room, but the Rasul of Allah sallallahu alaihi wasallam also uses the analogy of the heart. And the analogy goes like this: we are so one track in our thinking with regards to the physical world, due to our interaction with the physical body as practitioners. We often lose the essence of the inner self. When a cardiologist tells his patient how important it is to take an antiplatelet agent for a possible infarction or disease of the heart. But little do we consider the greater impact of disobedience to Allah subhanahu wa ta'ala and the stain that it causes on the spiritual heart. So this is the kind of thing that we need to, as practitioners who are all the time interacting with the physical world, and often we neglect the very important spiritual part of ourselves, which will guide us through these moral questions. The second part that is also very important and unique to us as Muslims and people of Iman, one of the fundamental facets of our Aqidah is the concept of being akhirah-centric. We are very dunya-centric, and our training and our scientific background allows us only to see a visual, a world through a dunya-centric lens. However, the little time we spend in the masjid, the little time we have exposure to shuyukh like our guest, we then begin to understand there's a greater dimension to ourselves, and this is the akhirah-centric approach to our life. Western ethics stops at the physical self, the physical world, and accountability in this dunya. Islamic ethics goes beyond that. It goes into the realm of the hereafter, into a life that is not confined to the boundaries of this world. And Allah subhanahu wa ta'ala sums it up very beautifully in the Holy Quran, and He says, وَلَلْآخِرَةُ خَيْرٌ وَأَبْقَى. And verily the akhirah is better and more permanent. Allah subhanahu wa ta'ala also tells us, and this is something we need to reflect on, where Allah subhanahu wa ta'ala says, مَنْ كَانَ يُرِيدُ حَرْثَ الدُّنْيَا نُؤْتِهِ مِنْهَا وَمَنْ كَانَ يُرِيدُ حَرْثَ الْآخِرَةِ نَزِدْ لَهُ فِيهَا وَمَا لَهُ فِي الْآخِرَةِ مِنْ نَصِيبٍ. Beautiful ayah of the Holy Quran, where Allah subhanahu wa ta'ala speaks to the same point, that those who wish to have the harvest of this world, Allah will give it to them. And those at the expense of the akhirah. And those who wish to have the harvest of the akhirah, Allah will increase them in it. And for those who wish for the harvest of this world, there will be nothing for them in the akhirah. So these are important things. And again, tied to this is a beautiful hadith of the Rasul sallallahu alayhi wa sallam, who mentions also that whoever makes his akhirah, whoever makes the akhirah his maqsad, whoever makes his akhirah his main concern, then Allah will place richness in his heart. He will bring his affairs together, and the world will come to him despite him not wanting it. And Allah will place poverty before his eyes. Allah will make him think about the very many expenses that he has to incur, not now and even after retirement, this is my words, but Allah will put poverty before his eyes, disorder his affairs, and he will get nothing of the world except what has been decreed for him. And finally, just two more points. We're speaking about ihsan, and Shaykh very beautifully and eloquently described this quality of ihsan. But ihsan also has this aspect, where the Rasul of Allah sallallahu alaihi wasallam says in a beautiful hadith that inna Allah kataba al-ihsan ala kulli shay, that Allah has placed ihsan in everything. And the Rasul of Allah sallallahu alaihi wasallam then goes further on to say that even when it comes to slaughtering an animal, killing an animal, what Rasul of Allah sallallahu alaihi wasallam teaches us beautiful, the teacher of mankind, فَلْيُحِدْ شَفْرَتَهُ, then sharpen your knife, وَلْيُرِحْ ذَبِيحَتَهُ, Rasul sallallahu alaihi wasallam is paying so much attention to an animal. How much more do we have to pay attention in ihsan with regards to our relationship with human beings, and particularly in the field we are. So we have to up our game, go beyond the call of duty when treating our patients in every aspect. And finally, Imam Shafi rahimahullah sums up this point that I made towards the end, and he says that al-ilmu ilman, that knowledge is of two. The great Imam Shafi rahimahullah, he sums it up. He says ilmu ilman, and I will speak to the elite category that you as medical practitioners are. Al-ilmu ilman, there's only two types of knowledge according to Imam Shafi rahimahullah. Al-ilmu tib lil-abdan wal-ilmu din lil-adyan, that the knowledge of this field of health sciences for the preservation of the body, and the ilmu din obviously the preservation of our akhirah. He also says that he does not know of any more beneficial knowledge after halal and haram than the knowledge of tib. So I leave you with this, respected brothers. We have a very important and pivotal role to play in our communities when they are fatwa based with regards to medical science, and we are the deciding factor for the fuqaha to decide whether something is permissible or not. Wa akhiru da'wana alhamdulillah.
Jazakallah, Yusuf. Finally call upon Professor Asim to deliver his opening remarks.
Nahmadu wa nusalli ala Rasulihil Kareem. Following from what our learned scholars have shared with you, I want now to share with you something of how do we actually, in the complex world of modern medicine, we face situations where right and wrong are not always black and white. As Muslims, how do we navigate these grey areas, especially when they concern matters of life, death, and human dignity? Alhamdulillah, we have a rich legacy, and we have to thank our eminent fuqaha, that is the jurists. They have come up with what, let me first tell you, you see, the primary sources of Islam in resolving the complex bioethical issues. First, we look into the Quran. If we do not find an answer in the Quran, we look into the Hadith. And if we do not find an answer in the Hadith, then we go on to Ijma and Qiyas. And then finally we come to what the Fuqaha, they have actually done a lot of research. They have looked into the specific ayat of the Quran, specific hadith of Nabi sallallahu alayhi wasallam, and they constructed what is known as Islamic legal maxims. These maxims are distilled principles derived from the Quran and Sunnah and juristic reasoning. Though short in form, they carry profound wisdom. Let me briefly highlight a few of these legal maxims which are relevant in bioethics. The first one is al-umuru bimaqasidiha. Matters are judged by their objectives. When a medical procedure intended to save life or reduce harm, even if it involves controversial means, this maxim encourages to look at the higher purpose. The next maxim is La darara wa la dirara fil Islam. Do no harm and do not reciprocate harm. This is crucial when deciding whether to withdraw futile treatment or when balancing risk in experiment therapies. Preventing harm takes priority. And the third one is al-mashakka tajlibu taysir. Hardship brings about ease. In bioethics, this justices legal concessions in cases of terminal illness or medical or mental incapacity. For instance, fasting can be suspended if it harms the patient. And the fourth one is ad-darurat tubihul mahzurat. Necessity makes the forbidden permissible. This helps resolve dilemmas like using porcine-derived medication when no alternatives exist. Life and health take precedence. And the last one, the fifth one, there are many more. Al-yaqeen la yuzal bi al-shak or bi shak. Certainty is not overruled by doubt. This maxim protects patients from unnecessary procedures based on speculative diagnosis. These maxims are not rigid rules. They are ethical frameworks that respect human dignity, uphold justice, and maintain the sanctity of life. Islamic maxims equip Muslims, healthcare professionals, and ethicists with a deep value-based approach to complex decisions. They reflect the balance of rahmah, mercy, hikmah, wisdom, and defines our deen. In today's rapidly advancing medical world, it is more vital than ever to return to these timeless principles, not only to protect patients, but to preserve our own moral integrity. Shukran. Assalamu alaikum.
Walaikum salam. Jazakallah khair, Professor Ebrahim. Without further ado, I think we're going to go into some of the questions that were submitted. So in the lead up to this convention, we sent out various messages to everybody who registered, asking you to pose your ethical and clinical dilemmas. I'm going to ask the tech guys to put up the PowerPoint quickly. We will take more questions. So you can either put up your questions onto the convention WhatsApp group, or you can scan the QR code. If you want to give anonymous questions, you can scan the QR code or WhatsApp to the number that's shown on your screen. So obviously the QR code will be anonymous, or if you want, you can put in any questions onto the convention WhatsApp group. We'll try to go through as many as we can. As Faisal alluded to, we tried to batch them, and there were two broad categories. The one was relating to Islamic bioethics, so the fiqh of organ transplantation and things like that. So that's one broad category. And Professor Ebrahim is the expert probably around the world on this sort of field. And the other category was sort of ihsan and best practice questions. So and as we were discussing in the lead up to this panel discussion, Professor Asim said it's the adab of tabib, the etiquette of a doctor. And some of them are clear black and white issues, but many of them are sort of these in-between grey areas. And as was mentioned, a lot of them you could say these differences of opinions in the scholars. But we'll try to go through some of them. The first one that I'm going to introduce is related to mostly to private sector and billing, finances, and we sort of titled this medical excellence or medical excess. So obviously for those who work in the private sector, we work for a fee. We're getting paid per patient that we see. So there's various issues which plague us in the private sector. Overservicing in the private sector, where people do unnecessary operations or unnecessary procedures, unnecessary admissions, unnecessary tests. So that's a broad category of overservicing. Also with regards to billing and coding, there's issues where within procedures you might use different codes. So obviously to explain it to those who are not in the private sector, there's certain procedure codes that you can bill for. If you do an appendix, for instance, there's an appendix procedure code, but then you can add something else and something else, which is sort of a drainage of an intra-abdominal abscess or something like that. Few other ones that came in was differential billing versus discounting, where you have patients who might have gap covers, and then you charge them 300% for the gap cover while you charge others the medical aid rates. Is that okay? Or how do we deal with these issues? So this broad, somebody also asked about exorbitant fees in private specialists overcharging or charging a large amount. Obviously this is a relative question. And it depends on the service. For some people, if you go see a cardiologist for 5,000 Rand for a consult, they might think that's excessive, but obviously the cardiologist is doing an echocardiogram, an exercise stress test, he's got all these technicians doing this. So that's just a perception that people might feel that that is overcharging. But in general, that's one big broad category that maybe ask Dr. Asim to first shed some thoughts on. It's a whole lot there in there, so I don't know if you can maybe break it up for us.
Assalamu alaikum. Gosh, where to start? Very good that this is coming up. Now, I speak as somebody outside this particular dilemma. I work for the NHS. I get paid a salary. And it's amazing how many of the questions that tend to come up about these things, I can just kind of go, no, because it doesn't relate to me, So I remember when the whole some medical controversy or other was going on, probably vaccines or something like that. As well, you guys just, it's just you're in hop with the big pharma, and I'm like, I don't get paid any more money to see 10 patients than I get paid to see one patient, right? In fact, if I see one patient, it's better for me because I can put my feet up, read the paper, or maybe make some zikr perhaps, and I'll get paid the same amount of money. Imam Ghazali, since we're on financial probity, so this is the maqsad of preservation of wealth. This returns to the question of preservation of wealth. Okay? And therefore financial probity, which is one of the maqasid of the Sharia. Now, Imam Ghazali mentions about this specifically when he talks about types of professions, and this is in book 13 of the Ihya, and he says that, it's 13 or 40 of the Ihya, and he says that there are certain fields where you need to be careful. For example, medicine. Although he classifies medicine as an obligatory science in the beginning of the Ihya, he says that you have to be careful because in those days as well, doctors would be paid. And he said that your livelihood depends on people being sick. Right? So you therefore have a motive to keep people sick so that you maintain your livelihood. And you just think, wow, okay. So it is understandable that there is a dilemma that sits in every one of us, or every one of you, I should say, sorry for this one, but this is every one of you, about actually how do you deal with the temptation to make money off your patients, or more money than perhaps you should be making off your patients. That is a proper, honest to goodness ethical dilemma that is very different from the question of the technologies of medicine and whether a particular technological intervention is permissible or impermissible. That's a whole different category story. This is about financial probity. So the question, there's a number of ways you can approach these questions. Okay, and there are specific questions. A number of ways you can approach them. The first is from the perspective of virtue ethics. What is virtue ethics? It's the type of stuff that we've been talking about. Ihsan, a sense of iffah, which is, a sense that God will, that I have to answer to Allah for what I do. Okay, one of my shaykh, I remember he said to me once, I said, I have an exam. Hazrat, I have an exam, please make dua. And he said, Beta, tell me something. You don't cheat in your exam. You were so much so, don't you cheat? He said, Hazrat, we try sometimes, but it's, you haven't studied it properly. And he said, tell me, is there anyone checking? He said, I said, there's an invigilator in the room. He said, so if the invigilator was standing right behind you, so he could see you, but you couldn't see him, would you look at the next guy's paper? He said, no, Hazrat, definitely not. Yeah? So he said, so if you wouldn't do that, then when you know Allahu Hadir, Allahu Nazir, Allahu Shahid, Allahu Ma'i, God is present, God is watching, God is witnessing, God is with you. How can you cheat then? How can you cheat? So virtue ethics, that sense of taqwa, is to know that you might be able to hide it from the taxman, you might be able to hide it from the medical aid, from the accountant, but you cannot hide it from God. So what answer will you give to Allah on the Day of Judgment? Right? And that's a proper Maulana Sahib answer. No offense to Maulana Sahib, but that's a proper Maulana Sahib answer, right? But it's true. And that is the core of financial probity. The answer to these questions in medicine is, how would I answer Allah on the Day of Judgment? Full stop. Because you are going to have to answer Allah on the Day of Judgment. And development of that sense of consciousness is very important. However, there are questions where it is not quite so simple. What about if a family come to you, the father, and this is a question that came up, father and mother are on the medical aid, child is not. They can't afford to put the child on the medical aid, but the child is very sick. The public healthcare system in this country is, you wouldn't send your worst enemy, so I hear, you wouldn't send your worst enemy into the public healthcare system in this country. What do you do now? Do you treat the child and bill for the parents? Right? Well, actually, maybe I might well turn around on the Day of Judgment and say, oh Allah, I helped that child. And if it meant I cheated the medical aid, but I helped the child. How would you answer that question? And this is where the fuqaha come in. This is actually where the ulama come in. To say, what actually are the limits here? When you are in a system which is an unfair, but still legally binding system of contracts. I take you back to what Mufti Sahib said, recited at the beginning last night. What Mufti Sahib said, Awfu bil uqud, hold firm to your covenants. This is a covenant you have taken. You have agreed to bill appropriately and not to overbill or, commit identity fraud and all of these types of things. What if a patient comes, they need an x-ray, but they can't afford the x-ray, they only have a hospital plan, and you admit them to hospital so that they can get that x-ray, they can get their investigations done. What about that? Right? These are the grey areas, and these are not easy questions to answer. And this really is where this question of what is the nature of the contract that you have with the medical aid companies, what is the nature of the contract that you have with the patient? So you have a contract with the patient to help that patient, to heal that patient. You have a contract, and that is the preservation of life. You see where these maqasid come in now. That's the preservation of life. You have a contract with the medical aid to not overbill the medical aid. That relates to the maqsad of the preservation of the wealth of that medical aid, which is made up of what? Which is made up of the contributions of the patients who pay into it. Now, if you regularly are overcharging the medical aids, and everyone does that, what's going to happen? The medical aid is going to pay out more money, and then what happens? What happens is everybody's bills go up. Everyone's medical aid payments go up. Alright? So how do you balance that against the fact that the more I bill, the more money I make? Right? Oh, I'm helping the child. Oh, I'm helping this person have, get the tippy-toppy best care possible. Right? But I'm also making more money that way. Now, one of the things that it is worthwhile, one way out of this ethical dilemma, is that what you do from an individual perspective and what you advocate for communally. Is there, for example, a system of charging that would mean that whether you get just an FBC UNE, or you get an FBC UNE, LFT, calcium, magnesium, this, blah, you get the same amount of money, so that there is no benefit to you, no benefit personally to you in ordering excess investigations. Okay? Things like that. You'll know better about these things than I will, but is there some sort of a system that we can advocate for that would be fairer and remove that temptation from from this situation? Because you're a powerful body. Okay? The Muslim doctors, this is a powerful body. There's lots and lots of Muslim doctors. And advocating for something like this, a fairer ethical approach to this, is something that is very worthwhile you thinking about and engaging in collective action in relation to. Now, that doesn't answer it because there are lots of questions that you pose. I think which one I'm supposed to answer. But I want to give you a bit of a framework to think about this. Think about your transaction with God, not just your transaction with the patient. Think about the individual versus your individual, balancing individual responsibilities, your responsibility to the patient versus your responsibility to the medical aid, and then think about the individual versus the communal. What is maybe in the individual's interest, but in the community's, to the community's detriment, or maybe to the community's advantage, even if it's to the individual's detriment. Okay? I just want to give you that framework of thinking about how to approach this, and I'll hand over to Ameer to answer the difficult question.
Yeah, obviously there's no clear-cut answer, and I think Sheikh would be the best to answer it. But because I work in the private sector, and look, I'm not going to be the standard to follow, and what I pronounce is not necessarily the absolute right or wrong. But yeah, as Mohammed mentioned, and I work alongside Mohammed a lot, so we understand that in private there are certain curveballs. And as Sheikh was talking to me the other day with regards to ethics, ethics is the field where there are competing priorities. We have things that compete with our moral conscience. On one hand, we have a sick patient who we know has come to us with only a taxi fare and a medical card in their hand, and they can only be treated if we admit them. They've got a hospital plan, and yet we know that the medical aid stipulates that no, all investigations should be done prior to admission. So this is what we say, competing priorities. Morally, consciously, we know that we could follow the rule book as it is, but in the heart of the matter, we are not doing justice to the patient because we know the affordability. So, and Sheikh alluded to it, and I'm happy that he mentioned this framework. And look, every one of these decisions are an individual decision, and also it boils down to our intention. And if we have this consciousness of Allah subhanahu wa ta'ala and our real intention, then we may pacify the onlookers with what we are doing with regards to our incorrect billing practice. But there is a day that we will not escape. So this is again, comes back to what we mentioned at the beginning, our moral compass and where it lies. But just for this particular instance, with regards to admitting a patient that has a hospital plan, which is a common dilemma all of us face, myself included, and we're doing it purely to help the patient. And where do we stand from an Islamic perspective? I'm not pronouncing this from a legal perspective and that sort of thing. I think the answer lies in your intention. And Allah subhanahu wa ta'ala will judge you on your intention. It's very easy. We are all intelligent and very easy to understand when it is clear-cut. We are defrauding a system when we are doing something as a deception, or we are genuinely doing something to benefit someone else. I'll leave it there. It's obviously an open-answered question, but this is where the answer lies.
So, just before we move,
I just want to come back because I've realized that I don't practice in this country. I'm not bound by the HPSA, HPC, that thing, all right? So I can't get into any trouble, all right? Unlike Dr. Yusuf, I can't get into any trouble here, all right? So let me just come up and say it, all right? It is an unfair system. What my advice, my genuine, specific advice, where some of these questions are concerned, okay? When you are acting in such a way that you know is of benefit to that patient, all right? And you know that there are two options for the management of this patient, outpatient and inpatient. You know that generally speaking, by and large, that this patient can be managed as an outpatient, except that they can't afford it. You know that admitting them to hospital to have essential investigations and so forth done will be in that patient's individual interest. In that patient's individual interest. Although it will be far more expensive, relatively speaking, because they are occupying a hospital bed. Alright? What do you do in that circumstance? If it was me in that circumstance, I would find a way to justify admitting the patient to hospital. Right? I would find a way, and I can say this because no one can hold me to account in this country, whereas here this is a public forum. I would admit that patient to hospital for a short period of time so that they could have the investigations they required, and what I would use is my medical knowledge to justify why that patient needs to be admitted. I know that before Allah, my answer is, you know what, Allah, my responsibility is primarily, yes, it is to the blah blah blah, the overall healthcare environment, but primarily to the patient in front of me. This patient should be able to access treatment. They can't access treatment because the system is unfair. I made sure that they can access treatment. Yeah, that is what I would do personally. But I would make sure it is for the minimum duration possible to have those investigations done, which means get all your ducks in a row, make sure that's in place, and then admit the patient. Rather than admit them for a week, so they sit in a bed for a week to wait for an investigation that would only have been available in a week's time anyway. Okay? In terms of overbilling, which you know is not in the best interest of the patient, there is no reason for you to do, I don't know, anti-nuclear factor antibodies, on a patient that is coming to you because they have, I don't want to say it because I'm going to mess up my medical knowledge here, I'm going to get it wrong. But there is no reason for these investigations to be done, but for some reason you get an extra 10 rand if you order this investigation. Yeah? Then save your akhirah, please. Right? Save your akhirah and save your medical practice, your license to practice as well. Alright? In those circumstances. The last thing I want to say before I hand it back to Muhammad Iman, and I'd say I'm being controversial because I can be controversial, right? I'm from overseas and I don't intend to practice in this country. Right? But look, I want you to understand one thing about Islamic law. Islamic law, there's 2 or 3 things you need to know about it. The first is that it is not idealistic. Often you will hear things, when I've got this topi on religious bayan mode, and you hear things that sound very nice but hopelessly idealistic. And you will say, oh, Maulana Sahib, Sheikh Sahib, but he doesn't understand the reality of how things work on the ground. Right? Islamic law is not meant to be idealistic. It is meant to be practical. It is meant to take the world as it is. Right? And give answers to ethical dilemmas to the world as it is. The second is that it is extremely sophisticated. So I've mentioned the Maqasid Sharia. Professor Ebrahim mentioned the what are called the Dawabit Fiqhiyya, which are these universal legal maxims, or let's say widespread legal maxims. The legal maxims provide effectively a connective tissue across rulings like this. They work horizontally. The Maqasid Sharia work vertically, you might say, teleologically towards a goal and so forth. But the law is very sophisticated. And whenever you have a sophisticated system, you are bound to throw up different answers to the same question, depending on which machine you put it through. Okay? This is one of the reasons that you have madhabs in fiqh, you have legal precedent and so forth. It is just like in medicine, you have grades of evidence. You have meta-analyses versus RCTs versus cohort studies versus. You have the same thing in Sharia. You have the same thing, you have levels of evidence. Right? You have levels of certainty. Some things in medicine are absolutely 100% certain. Patient's got an aortic aneurysm. If you, a burst aortic aneurysm, if you don't sort that out in the -5 minutes, that patient's going to die. There's no question, no two ways about that, right? But your long-term management of this patient's diabetes, is it going to effectively work or not? Who knows? Maybe, hopefully, possibly. We're not really sure, right? Similarly, in Islamic law, you have that which is qat'i, it is absolutely definitive, and then you have gradations, a hierarchy of certainty from dhann downwards. We're 90% sure this is correct. We're 80% sure this is correct, and so forth. So I want you to understand, sometimes people get frustrated with Islamic law. Why can't you just tell us the answer? I can't. I can tell you that this is probably the right answer, or that this is maybe the right answer, or that there are 2 different answers to this question, but I can't tell you which is the right answer. Do you know why? Because my name is not Muhammad Rasulullah. That's why. Okay? So please do understand this, and I'll hand back, after my rant about Islamic law.
Maybe just to play devil's advocate for Yusuf Ameer, I understand إِنَّمَا الْأَعْمَالُ بِالنِّيَّاتِ. What sways a lot of us is what Asim mentioned at the outset, and that is knowing that referral to the state is a huge problem for all of the reasons we all know too well. What if the state wasn't so bad? So government system was okay. Queues weren't so bad, facilities were there, you could get your X-ray, MRI done in a reasonable amount of time. But you still had the patient pitch up. And I'm paying so much, we know it, right? I'm paying so much for this every month, doc. I can't go stand in the queues. I got to go to work. And those famous words that makes us all architects in South Africa make a plan. That we all are asked to make a plan all the time. So, in the moral rationalizations in our head, one of the things that family practice see this even more than the specialist is we swear we know, yeah, state is a problem. We have to pick up the phone, ask Yusuf, ask someone else, try and beg the specialist, can you do this, can't you do this? Knowing also we're asking almost for a favor and putting the specialist in an awkward position. But if the state was decent, could we still find that moral rationalization in our head because the patient is paying and they don't want to stand in the queue and there's an element of class, racism, etc. in some of those issues?
So related to that also, so you mentioned that if you have a patient in need, you'd admit them as a darurat, like they really need to be admitted for the workup. But we often find they might be, as Faisal said, the patients who are not really of stringent means, but they'll come for an annual or every 2 years, just admit me, do every test, or like a checkup. Just admit me for all the checkups, and or they'll say the famous line, whilst I'm here. So they come in for a gastro, and then whilst I'm here, my prostate is inflamed or my back is hurting, and suddenly they've seen every specialist in the hospital, have an idiot test, and then they come, or if the gastroenterologist is the treating physician, and they came in with a cough, suddenly they come in for a scope. If you hammer, everything looks like a nail. Or if you come with a pulmonologist, is the treating doctor, they come in with a gastroenterologist, suddenly they're getting lung function tests. So how do we also handle those issues? It's on the same sort of topic of private sector work.
Confusing because this is confusing because there are two Yusufs sitting up here. So you need to be clear which Yusuf you mean when you have to answer the question. I'm going to hand it over. I'm going to be hopeful in it.
You're going to watch me drowning or? Okay, Bismillah ar-Rahman ar-Rahim. So I can relate to this question very much so because I'm in the private sector and I work very closely with all the sentiments shared here. And I think it comes down to the fact that there's clear-cut haram and there's clear-cut permissibility, and in between we've got a spectrum. We could call it different shades of whatever. And this is the spectrum we're talking about. And I'm glad that Sheikh, our esteemed Sheikh, mentioned this point, is that sometimes we do have this concept of the Islamic or the Sharia or the fiqh being idealistic, whereas the fiqh is not idealistic. Sharia is very practically based. And one of the things I think, and really there are so many dawabit or maxims that would go into helping us as practitioners answer this difficult situation if we had a very sort of deeply researched mufti on the panel. What he would be able to do is apply some of these dawabit, some of these maxims, and give us a clear cut, maybe not an answer, but a way forward. Why I'm saying this is that there's competing again priorities here. We know how the medical aid system works. We know patients take out a hospital plan, and it goes back to many things. The man's got a hospital plan, the affordability is an issue, and yes, it's not the right thing to do more than what you've admitted him for. But there's an opportunity cost for him, there's opportunity for work, there's many things that go into being a source of convenience for that patient. And that's why I say there's a concept of haja. There's not necessarily darura, as Muhammad Raymond mentioned, but there's a concept of haja. And some of the fuqaha would also say in certain situations when haja would reach the category of darura. So it's a very intricate and sophisticated science. The fiqh is more sophisticated than even, I was going through this and trying to form an analogy for us to understand the comparison between our science, our health sciences, or any field of science and the science of fiqh. And just as we all had this in maybe second year or third year, the causes of an item, then we go on to the congenital and acquired, and then under acquired we had a whole list of things. This is pretty much more sophisticated than that is the Islamic fiqh, and the way the work on the mind of a jurist would work to answer difficult. So it's a difficult one to answer. Safe to say is that it's a situation where you use your conscience and your moral compass. There is a clear-cut boundary that you do not step, And the Rasul sallallahu alaihi wasallam said, it made it very clear, the one who deceives is not one of us. He spoke about the incident where he saw, one of the traders selling wheat, and the wheat on the top was dry and the wheat at the bottom was wet. And the Rasul sallallahu alaihi wasallam put his hand in there and he says, the one who deceives us is not from us. This is clear-cut deception on one hand. And then obviously we know there are then very many arguments towards these competing priorities that we have towards our patients. Sheikh, maybe you can bail me out.
I don't know whether Prof wants to comment. Huh? Well, so Prof said he doesn't deal with medical insurance, which is interesting because it is a medical insurance. I mean, when we were having our preliminary discussions, I did kind of I find it faintly hilarious that we're not asking the question, is it permissible to have medical insurance in the first place, actually? Quite apart from anything else. And I said, no, the ulama here have given a fatwa that you can have medical insurance, which is a perfect example of how fiqh does bend to reality. And that's a perfect example of it. I mean, I remember discussions in South Africa about, whether it is, you have to have car insurance, so do you have to take third-party insurance only, and you're not allowed to get comprehensive insurance because the third party is mandated by law, but the comprehensive part is something that is 100 grand more, but it is over and above, and that's a riba, and etc. And yet here we're talking about probably every single person in this room, and probably most of the people that you know, have medical insurance. I mean, when my parents were here, my parents were living here for many, many years. They only moved back to stay in the UK, 2 or 3 years ago. They were on medical aid, and it was the most expensive expense that they had. It was their medical aid. They come to the UK and everything's free. Yeah, you've got to wait 6 months for it, but it's still free. So coming back to your question, oh, by the way, it isn't free. The healthcare system in England is not free, right? It is funded by taxation. There is a separate tax that we all pay called national insurance. National insurance funds the national health service. Okay, so I basically never used the NHS as a patient. Alhamdulillah, I'm in good health. I've never used the NHS. So I'm putting 10% of my salary towards other people's healthcare. And I remember when I was talking to some students about this, and I said, you should consider your tax to be a form of sadaqah, to be charity. They said, what do you mean? I said, well, where does it go? It goes to providing healthcare for people who cannot afford healthcare, education for people who cannot afford education, security for people who can't afford security, roads for people who otherwise would have very broken down roads. You are looking after vulnerable people in society via your tax money. Because in England, there's not that much corruption. So even if 5% of it goes in wastage and corruption and so forth, most of it actually is providing for people. This is sadaqah. You should make the niyyah of sadaqah when you pay your tax. Now, the question, however, of this question about if the health system was better, that's right. If the health system was better, okay, at that point the emperor would have no clothes. Okay? The fact of the matter is, the healthcare system in South Africa, the public healthcare system in South Africa is terrible, and therefore, right, is probably a good argument, but it can become an excuse for us to make more money. Right? Beware, and this is why alhamdulillah, each of these 2 sessions we've had has been very well set up by the first presentation. The Qira'ah yesterday and Amin's talk today. Right? As well as Prof Dango, who's mentioned very similar things about your internal self. It really does, a lot of this comes down to conscience. This is when the Prophet ﷺ said that ask your heart, istaftu qalbak, walau aftuka nasa aw aftuk. Right? Even though people give you a fatwa or fatwas are around, you still ask your heart. Now this does not mean, well, the fatwa says I have to wear hijab, but I asked my heart and my heart said no, you don't. Right? It actually works the other way around. It's people say it's permissible, but my heart tells me, my heart does not sit easy with it. And so out of wara, out of religious precaution, I'm going to refrain from it. This is the meaning of the hadith, ask your heart. Right? Otherwise, you're trying to ask your heart, but you're aiming low. Alright? And you're asking something else instead. So, if the healthcare system was better, what that would impact on is our ethical thinking. And Maulana Sahib gave a very good, he kind of alluded to a very good sort of framework here. And that framework is sometimes known as the levels of gravity in Sharia. So you've heard these terms chucked about darura, haja. How many of you know what these terms are? What they mean? Okay, so this is why Islamish should always be avoided, right? Islamish is the insertion of Arabic phrases into our speech, and we just assume, inshallah, mashallah, bismillah, hasbunallah, right? We just assume everyone knows what it means. Darura means legal necessity, right? Darura is a state of emergency where the normal rules of Sharia are suspended. The famous example is you are on a ship adrift at sea, there is water everywhere, but not a drop to drink. Okay, and the only thing you have on board the ship is a casket of wine. Can you drink the wine to stave off death from starvation/thirst? Yes. Why? The normal rules of the Sharia are put on hold in order to preserve your life, because the preservation of life takes priority. It is an immediate necessity. That is the meaning of darura. Beneath that, you have something called haja. And haja means there is an overriding need that does not rise to the level of a necessity. Okay? So a person, for example, who has a chronic health condition, who cannot afford the medication, it's not going to impact on, let's take diabetes as an example, okay? And they need a certain type of medication, let's just say Ozempic. Since we're on it, since it's the thing at the moment, Ozempic, which is, was devised originally for type 2 diabetes, right? You have this, but then you have other less good forms of management of diabetes, for example. Immediately, it's not going to make a difference. It's not going to kill the person if they don't get the super duper treatment today. But in 20 years' time, in 30 years' time, what effect will it have? Alright? That's called haja, where there is a need that a person, an overriding need that may lead to, and the way the ulama use this is that darura, necessity, makes the ordinarily impermissible permissible. Haja allows for the adoption of a less strong legal opinion over a stronger legal opinion. So there are a range of legal opinions. Some are strong, some are weak. Because of a haja, you may take a dispensation of adopting a weaker legal position in order to fulfill the need of that person. And the last level, which you don't hear that often, is called the tahsiniyya. And tahsiniyya is something is an accoutrement of life, something that would be nice. Okay? So your haja, put simply, your darura is oxygen. Oxygen is a darura. Okay? A balanced diet is a haja. Okay? The lovely pastries and burfis and biscuits that you have outside is a tahsiniyya. Right? Then no harm is going to come to you if you don't acquire it, but it makes life enjoyable. Okay? Now here we've had, I think, questions, for example, of cosmetic surgery and these sorts of things. This would be considered, unless it's for like cleft palate or something, cosmetic surgery, I want to go on Ozempic because can you get me onto Ozempic in my medical aid because I want to lose weight and have a really nice figure, right? As all the guys know, right? We all want to have nice figures, guys, right? Okay? Or I want to have Botox, guys, come on, seriously, right? But I want to have Botox because I want to lift my cheekbones and so forth. This is a tahsiniyya, right? And tahsiniyya does not permit any form of legal jiggery-pokery, you might say, all right? So another approach that you can take here is as medical professionals, is the idea of, is this a necessity? Is this a necessity? Is this a pressing need that this person has, or is it something that is better? Coming back to you, you're wondering where I'm going with this, right? The answer to the way I would approach, I should say, answering this question of if the healthcare system in a particular thing, and you will all know your fields better, but if the healthcare where a particular thing was concerned in the public sector was not much below the level of private, the patient might have to wait a bit longer. They might have to go and sit in Addington Hospital or in something along those lines to get that treatment and so forth. But fundamentally, they get the same sort of treatment either way. This is their usage of they're asking you to bend the rules, break the rules of the medical aids in order to get it faster, to get the name brand drug rather than the generic drug, for example. This would be a tahsiniya. And a tahsiniya would not permit this kind of bending of the contractual rules. A haja, that's a different matter. A darura, all bets are off at that point. So hopefully that is one way of looking at this. So at the moment, if you're looking at your public healthcare system, you're looking at the private and you're looking at the gulf between them, and you're saying, well, this is ridiculous, as I said at the beginning, and it may be it may be a stereotype or a caricature, okay, but you wouldn't send your worst enemy into the public healthcare system. Well, you're talking about quite a difference if that healthcare system were to improve. And what is then, this is where I come back to the idea of the individual and the collective. As clinical professionals, we should be supportive of the improvement of the public healthcare system on a long-term basis, okay? Rather than contributing to the degradation of the public healthcare system in order to enrich ourselves because we get more money from people coming from medical aid. I'll make it easy to say.
Well, I just want to add to that quickly. I mean, there are some sentiments that we have to be real about on the ground. And all of us know that sometimes there are procedures and a remuneration that we don't necessarily get the full amount for our worth. So if you're doing some intricate procedure, you get paid what you feel is way below what that procedure is worth. The other thing that occurs often is that it's the medical aid dictates to a certain specialty how much they're going to get paid, and it's often not sort of market value, and it's not fair. And then there are practitioners who would then charge more than the rate on the medical aid. And that's a common scenario, and that's also a common moral dilemma, because some practitioners feel we'll stick to the medical aid rate because that's what they stipulated. And I think from an Islamic perspective, purely from the fiqh of Buyu, is if you're upfront with your price and your customers or your patients know this is what you charge, 300% is what I charge and I feel I'm worth that, and they're agreeable to it, then in terms of Sharia, that is perfectly above board. So, as I say, there's certain things that are clear-cut. If you're a practitioner, the question will come in and some will feel you're abusing the fact that, the medical aid is paying you 100 rand and you are charging 300 rand. You're not justified for it, and if you have a leg to stand on and justify why you are worth 300 rand, then the Sharia would uphold that. So these are important things that we need to understand. Those are not grey issues, they are clear-cut issues. You are allowed to charge what you want to charge if you feel you are. Yes, at the heart of the thing is that we need to also understand the condition of our patients, the affordability and that sort of thing. And that goes into a separate issue, not necessarily clear-cut haram and halal, but it's in terms of, as I say, ihsan, and how much we're willing to do good. But there's many arguments for it and against it. One of it is with our tax, we are funding those patients. We are doing a lot of pro deo work for private patients anyway, so we are doing our fair share, but we should be allowed to charge.
Okay, I just want to move away from private sector and billing issues. We spent a lot of time on it. Just moving, there have been a few questions about public sector. And we touched on it, Amanah Breached, navigating duty and integrity in the public service. Some of the questions was, a public sector doctor, do they need to work the 8 to 4 job contracted hours, or if they're done with their work, can they then go earlier and work in the private? It's touching on what you mentioned about enriching the public sector to bring it up rather than enriching yourself. Also about abuse of maybe state facilities and resources in terms of taking things, or those are probably more clear cut, where you maybe using a phone, government phone, to make your own personal calls or something like that. If you just want to maybe comment on that, Sheikh, one of the Yusuf. Prof is more bioethics. He will come. We'll ask him some of the bioethics questions.
So this question of public-private sector will relate, and this is something that's very clear from a Sharia perspective, is what does your contract state? So there are two types of workers, effectively, from a contractual perspective. The first is a worker who is paid for their time. The second is a worker who is paid for their skill. All right? So, for example, you hire somebody to build a house. All right? The main builder, you are paying him for his expertise. All right? He will charge you X amount of money, and he's charging you for his expertise. He pays his laborers who work for him. He pays them by the hour. Okay? So there are these two types of contracts, and the question is, a professional contract, what is the nature of a professional contract? Are you being paid to fulfill certain responsibilities, such that when those responsibilities are fulfilled, you have done your job, you've earned your money, you can do whatever you want with the rest of that time, or are you being paid for your presence, for your attendance, and therefore being paid by the hour? Right? So in the NHS in England, this often comes up, actually. There are people, and England is moving towards a more hybrid system with private, with people doing private work, and this question comes up very often. Okay? The question of, can I, do I have to come in at 9 o'clock, or can I come in at 9:30? All right? This sort of question. And the answer is, what is the nature of the contract? What is the nature of the contract? And generally speaking, professional contracts, you are paid for your expertise, you are paid to fulfill a certain responsibility. And provided you are doing that appropriately, you are not cutting corners, all right? You are paid today, what is your job? My job in my public sector work is to do my ward round and then write my notes up, okay? I have seen the patients on the ward, I have seen them properly. I haven't cut corners because I want to go off. I have seen them properly, I have done what I'm supposed to do, I've ordered the investigations, I've written up my notes and so forth. I have 2 hours left in the day because I work efficiently. All right? In that case, that 2 hours is your time. You have done what you were paid for, and you have this time free. If, however, you remain on call, yes, but we want you to stick around in case something happens, right? In case something is needed or so forth. And that is part of your contract. What is the nature of what happens there? Well, then is the question of what does being on call mean? If it means taking a phone call, delegating the responsibility to somebody and so forth, but generally speaking, I don't have to go in. Right? I won't have to go in. I'm not going to be called in for an emergency procedure or anything like that. Then fine. If it is, yes, I can be called in for those things, but other than that, my time is my own. What can you do? Well, if it's the first type of a contract, where it's likely just to be advice that I have to give to somebody, I know the type of work that it is, and there is a tacit, it doesn't have to be contractual, a tacit agreement, a gentleman's agreement with the hospital and so forth, that I'm going to be doing my thing, I'm around if you need me, I'm around for phone calls if you need me. There is no problem with that. If, however, you know that you might be called in to go and perform an operation at 4 p.m., you finish doing what you need to do by 2, but you might be called in at 4 p.m. to do an operation. Okay, what can you do in that time? Well, there's admin work. That is, you're sorting out maybe your billing, and I don't know what you guys do. Do all that extra billing, all those extra procedures you're charging for. You're doing all the admin for. You're doing the admin for those sorts of things. But you know that this is something that is. I can do it now. I can do it in half an hour. I can do it over, in a night. Then that type of work, as part of your private work, is permissible to do because of the nature of the contract that you have. But what would not be permissible in that second scenario where you may be called in as an emergency to see a patient, it would not be permissible to take up time that you could not get out of. To start an operation in private, for example, knowing that you may be called to do an operation in the public sector, right, in that same time period. Okay? So that is how, from a Sharia perspective, it goes back to the type of contract that you have. And clarifying the type of contract that you have in 2 ways. The first is formally, and the second is in terms of what is informally agreed. Okay? This relates to, and I remember I'm here only talking about, I'm not talking about the perspective of South African law at the moment, because that's not my field. I'm talking about Islamic law. This is how it would work. The question that you need to consider, which has come up here, is what is the status of a national law in Sharia? Right? what status does a national law have in Sharia? So I remember somebody asked me the question, and I mentioned this to you guys. In England, do I have to wear a seatbelt? When I'm in the car, do I have to wear a seatbelt? What is the legal, Shara'i ruling on wearing a seatbelt? And I said, wajib. And he said, oh, why? Because of the danger. I said, no, not because of the danger. It is wajib because it is the law of the land. It does not contravene any principle of the Sharia. And the Prophet ﷺ said, al-urfu muhakkam, which means that the customary practice of a people is given legal status in Islam, provided it does not contravene the law of God. In other words, the law of man is respected in Sharia, provided it does not contravene the law of God. Okay? National law and customary practice among people, professionals and so forth, has exactly the same status in Islamic law. Whether the rules of engagement are agreed between 10 people or in the context of a profession, or they are agreed at the level of a government, from an Islamic perspective, it has the same status. And therefore, Islamically, whether it is a formal agreement or an informal agreement, it is equally binding from the perspective of Islamic law. So I hope that helps to answer the question.
I think that last point Asim made works well into the next batch of questions we received, and a lot of them were permissible in our legislation, but not necessarily permissible Islamically. So there were a few. One was prescribing oral contraceptives to unmarried Muslim men or women, referring a patient who wants purely cosmetic facial surgery for aesthetic purposes. There's no medical indication. The big one in this day and age, patients who come to us wanting either hormonal treatment or referral, etc., for LGBTQ issues, gender transformation and gender affirmation issues. There were some questions on Ozempic, but specifically for weight loss during Ramadan. And similar issues, abortion came from a pharmacist. What does the pharmacist do when somebody pitches up with the misoprostol script? If Muhammad's doping on a list and he knows, I don't know how he knows, the gynecologist books the TOP, but this TOP is, it's not a medically indicated TOP. Okay, so the anesthetists don't ask, they just put you to sleep. So those were the issues that came through. So permissible under exactly our law, mandated by the HPCSA that you have to do what is in the patient's interest, but like the pharmacist having to dispense, and of course two pharmacists, one is in government, he has to do it, the private pharmacist I assume can tell the patient if he's not happy, listen, I don't have stock, but the pharmacist in government is where this question came from, and then the questions of for example, contraceptives to an unmarried man or male or female Muslim. That's just the general summary of it, but I think the principles will apply.
Bismillahirrahmanirrahim. Now, this is a very interesting question. Whether we can supply, a patient come to you, they are Muslims, and they want to prescribe contraceptive pills. Now, the Quran is very clear. Allah subhanahu wa ta'ala says, وَلَا تَقْرَبُوا الزِّنَا. Do not come near to adultery. Right? And now you are the physician there. And you have the patient here. Now the patient comes to you. Either you refer that patient to someone else. You say if you can go to the other doctor. If you don't want to do it. If you don't want to prescribe the contraceptive pills. But then, when you look at what Sheikh Asim was saying about preservation of life and so on. So now if you do not prescribe the pills and you are not there to be there watching them and so on, so then what happens is you may fall pregnant and then go for abortion. So preservation of life, then you're destroying a life. So in that respect, I say, perhaps it is wise. We know that, it's very difficult for us, especially today in this world. The iman of Muslims, like our Standard Bank person, Yankus, iman goes up, it rises, and it also falls. So we are not there to, we should not be the judge, right? We should not be the judge, but rather, if we are going to preserve the life that is going to come, and then we decide, okay, we will prescribe the drug, the contraceptive to that person. It might be the lesser of the two evils, looking at that. So anyway, that's my opinion, and that's what Sheikh had to say.
Prof, while you're on that, what about the pharmacist who is asked to dispense abortive drugs? Can a Muslim pharmacist dispense an abortive drug?
Anyway, interesting question, but I feel that as far as a pharmacist is concerned, and he must have stock of these medications in his pharmacy or her pharmacy. But then I would suggest then that the best thing to do is to tell, if it's possible, if legally bound in this country as far as the laws are concerned, that you can refer to another pharmacy or another pharmacist who will do that. I think it would be better in that respect to do that.
So, Jazakallah khair, absolutely, and I think that's a very balanced answer, mashallah, because there is a short-term and long-term benefit and harm that has to be considered here. Additionally, the importance of maintaining therapeutic relationship with your patients. Remember, we are not moral arbiters of people, but at the same time we should be people of nasiha. And actually how you balance the question of nasiha in this context and circumstance is very important. We often feel that giving nasiha to people is a one-off. Don't do this. And now I've done my thing, I've done my nasiha now. Right? Actually, nasiha is not about simply, or true nasiha is not about simply saying what is you are supposed to say. It is about actually it coming to the heart of that person and affecting them. And that is in the context of a long-term relationship. Okay? So I'll give you the islahi element and then the fiqhi element. From an islahi perspective, doctors are counselors. We are ministers. This is the whole point. This is the non-technical part of medicine, the soft skills of medicine, that therapeutic relationship. I mean, you all have heard the placebo effect. And the question, what is the placebo effect? The placebo effect is the therapeutic relationship, basically. It is the sense of hope that you inspire in a patient, that yes, I'm going to try to help you. Yes, let me listen to your story. Yes, tell me what is going on. All the things that I was saying about who is the person you are treating. These things, we now know, activate complex neuroimmunological and endocrine pathways that stimulate healing, that stimulate the body's own, because you will know this, you don't actually heal anyone. The body heals itself, you facilitate the body in healing itself. Alright? And that therapeutic relationship is hugely important. How many of you think that if I do not prescribe somebody oral contraceptives, they are going to rethink their life and say, you know what, I'm not going to commit zina after all. Yeah? And how likely is this scenario to occur? Alright? However, there is a big however. From a fiqhi perspective, ultimately, all of these questions that have been asked come down to one legal principle. And that principle is called ta'awun bil-ithm, assistance in sin. What constitutes assisting somebody in the commission of a sin? Right? When are you an accessory to murder? Alright? At what point? And this is something that Sharia takes very seriously. Most of you will know the hadiths in relation to Allah has cursed the one who drinks the alcohol, the one who pours the alcohol, the one who sells the alcohol, the one who buys the alcohol. But hang on, the person who buys it, the person who sells it, the person who pours it, they're not drinking it. So what's the problem with them? They are assisting in the sin of another person. And to assist another person in committing a sin is to assist them on their way to hell. Hence Allah says, وَتَعَاوَنُوا عَلَى الْبِرِّ وَالتَّقْوَى وَلَا تَعَاوَنُوا عَلَى الْإِثْمِ وَالْعُدْوَانِ. Help one another towards good conduct and heedfulness of God. Do not help one another towards disobedience of God and enmity towards one another. So the fuqaha approach this question, particularly Hanafi fuqaha, approach this question in a very nuanced way. At what point are you assisting in sin? So let me give you a simple example, right? The one who sells, the one who buys, the one who this, the one, all that alcohol, right? If you are working as a cashier in a supermarket, right, in Pick and Pay, up the road, you're working in Pick and Pay by the sea, all right? And someone comes along and they've got the bananas, boop, and then the grapes, boop, and then the bread, boop, and then the 6 cans of Casa Lager. And what do you do with the 6 cans of Casa Lager? Is it permissible for you as a cashier to go, boop? Is that permissible? Yeah? Are you assisting that person in the commission of a sin? Now the fuqaha approach this question, and generally speaking, the Hanafi fuqaha say the only prohibited assistance is that which directly leads to the sin you committed. This is the principle in the Hanafi school, and therefore, as a cashier, yes, you can pass the Casa Lager from here to there. Okay? Whether you can, because you are not the owner of the Casa Lager. You are not selling the Casa Lager, right? It belongs to the managers that can pay. Okay? Now, as you as medics, when it comes to oral contraceptives to unmarried people, when it comes to questions of abortion and so on and so forth, are you directly assisting in the commission of a sin? That's the question. And this question is detailed, nuanced, and sophisticated. The answer to all of these questions, you might think, oh, it's cut and dried. No, it isn't. These are not cut and dried questions. If you open up the question, you open up the, I'm not talking modern books, the classical books of fiqh on the question of abortion. On the question of abortion, and you will find detailed, nuanced arguments about self-aborting, about assisting in abortions, and what stage the abortion is carried out, and so on and so forth. These are nuanced, detailed discussions, and these are the types of questions that should be put to the fuqaha. Now, the role of non-specialists, like you are non-specialists in law. You are specialists in your own fields, but you are non-specialists in Islamic law. The role of non-specialists is to do what is not to give fatwa, but to do istifta. Istifta is to seek the fatwa. Imam Nawawi wrote a very famous work. Imam Nawawi, the great scholar, wrote a very famous work called Adab al-Mufti wal-Mustafti. The adab of a mufti and the one seeking the fatwa. So the one who gives the adab of the one who gives the fatwa, the adab of the adab a person giving fatwa should have, and the adab that a person asking for a fatwa should have. And what's the adab of asking for a fatwa? Simple. Ask a good question. Half of knowledge, Ibn Abbas said, nisful ilm husn su'al. Half of knowledge is asking a good question. What is a good question from your room of specialists? A nuanced, detailed question that lays out exactly what is entailed and what is involved and what would need to be done. That is what allows the muftis or group of muftis to really address that question properly. Mufti Sahib, can I do an abortion? Is not a good question. That's not a good question. Right? Mufti Sahib, if a person comes in a situation where they are 13 weeks pregnant and the baby has condition 1, 2, 3 and 4, which means this for their life or the mother's life or whatever, in that what would be the circumstance here? What would be the circumstance there? What would be the circumstance there? One of the earliest works of Hanafi fiqh is called Kitab al-Asl of Imam Muhammad ibn Hasan Shaybani, the student of Abu Hanifa. And if you read it, it doesn't read like a normal fiqh text. It is questions and answers. Right? What happens is Imam Muhammad asks Abu Hanifa a question. Abu Hanifa provides an answer. Imam Muhammad then says, oh, what if it was that? What would the question be? What would the answer be then? Gives an answer. But what if the situation was this? What would be the answer now? And what you find is subtle variations in the circumstance bring about quite significant differences in the legal opinion. So you get this situation and this situation which sounds very similar to it. And the answer would be halal, haram. Okay? So what is important for us to do here as a group of medics is actually to formulate really good, detailed questions in order for not one mufti, but a group of mufti to really, you want to really give them a hard time, you want to rack their brains, believe me, you really want to pressure them and push them, and don't be afraid to ask the follow-up, and ask the follow-up, and ask the follow-up, because you want the specific answer, the specific detailed answer. In England, a question comes up about patience and fasting. So there was a question about Ozempic and fasting or something. I'm not sure what the relationship is. Or is it appetite suppressant? Is that to use it as an appetite suppressant? Yeah.
I'll just expand that question to two parts on fasting. One is the use of appetite suppressants, because it's taking away the test of the fast. But the other, while we're at it, it's come up before, is, which is a bit of a fashion in some places now, is while you're fasting to go for a vitamin boost injection or a vitamin boost drip. I'm sure many of you have seen it, or we've certainly seen on the radio shows, etc., being asked. So again, the appetite suppressant, and of course Ozempic, not for appetite suppression, but for weight loss, and the use of IV vitamin injections or drugs, etc., while you're fasting.
So I'm going to definitely ask Manasa to come in on this question. A number of these things, these are not just common questions asked today, right? By the way, we often think that the medical questions that we ask today are, well, there'll be no point opening the books of fiqh, because you'll never find an answer about these things in the books of fiqh, right? Which in many cases is true, but what you often find are derivative cases. Let me give you an example. There's a famous / infamous fatwa in the Shafi'i, in the works, in some of the advanced works of the Shafi'i school. And the question is this: if a woman, and this is a genuine question, we're all adults in this room, if a woman is impregnated by a bull, and she produces a child who is half man, half bull, in other words, a minotaur, right? Can that minotaur lead the Eid prayer? This is a genuine, honest to goodness question. Can the minotaur lead the Eid prayer? The Eid al-Adha prayer? And after the Eid prayer, can the minotaur be sacrificed? Right? Now, this is one of these awesome questions that comes up. The fuqaha, the fuqaha have a sense of humor, right? Someone's asking a question like this, and you think, seriously, right? But you know why this question is asked? This question is asked because there were versions of artificial insemination that women would utilize in pre-modern periods. They would find something, the husband maybe was impotent or couldn't produce a child, they would find semen from somewhere and insert it in order to engage in artificial insemination. Right? And the question was, what if the semen that this woman finds is not human semen, but it's actually the semen of a bull? Right? And she produces this minotaur. And we have a good laugh at that, but the fuqaha actually answered the question seriously. And the answer was, if the minotaur is able to speak, and such that he can recite Quran and so forth, then yes, the minotaur can lead the Eid prayer, and no, can't be sacrificed afterwards. But if the minotaur cannot speak, then the minotaur cannot lead the Eid prayer, and yes, can be sacrificed afterwards. Now we have a good laugh at this, mashallah, very, very funny. However, today, that comes into the question of xenotransplantation, of chimera. This is an honest to goodness, technological, there's a techno future that we are looking at. Grafting animal DNA into human DNA and so forth. It actually has real world relevance today. A fatwa from 500 years ago. Similarly, there are questions about awliya Allah. If there is a wali who, by what is called tayyul ard, the rolling up of the earth, this wali is able to teleport themselves from one place to another place on the earth. It's a genuine question. Ibn Hajar Haytami, the Shafi'i jurist, deals with this question. If this person reads Maghrib, they read Maghrib in Lahore, and then they teleport themselves to Medina, and the sun has not yet set in Medina, and then the sun sets in Medina, do they have to pray a second Maghrib? And you think, well, but this was a genuine question asked. The answer, by the way, is yes, they have to pray the second Maghrib. Okay? That was Ibn Hajar's answer. Relevant today? I fly from Indonesia to Paris, and I overtake the sun. So it is Maghrib when I leave Indonesia, I pray my Maghrib, I fly to Paris, by the time I get to Paris, the prayer has not yet occurred. The Maghrib has not yet occurred. But then the sun sets. This literally happened to me. I flew from Thailand to Paris and read 2 Maghribs. Okay? These questions have real relevance. So these questions are not, appetite suppression is not a thing that people thought about today. They thought about this hundreds of years ago. Or have this for seri because it'll suppress your appetite. Have that for seri, it'll suppress your appetite. Right? Have this thing, it'll increase your sexual prowess. Aphrodisiacs, Viagra. These questions were asked in those days, and there are answers in the books of fiqh. So these things do exist, which is why it is worthwhile asking ulama these exact questions. Okay? In England, there was the question of what to do in fasting for various conditions. Should this person fast? Can't they fast? Etc. Etc. A group in South Africa, similar to you guys here, the British Islamic Medical Association, got together a whole host of specialists in different medical fields. They got together a group of religious scholars. I was one of those people. I was one of the editors of this. They produced a 150-page set of guidelines dealing with virtually every medical condition, the gradations of severity, and a risk matrix for a clinician to apply to determine whether a person in that circumstance can fast. And that's available. You can go download it. It's a PDF. You can go and download it. That is a really good example of clinician and jurist interface. Okay? And this is really worthwhile doing, this kind of collaboration with the ulama, I would suggest. Now my many minutes are up.
Okay.
Sorry, just a one quick answer perhaps on the plastic surgery, and I know I'm in danger of asking a psychiatrist because there will be a long answer, but so 2 quick scenarios. The one patient has both no medical indication, one, for use of example, a nose job. One has no real deep psychological issues, just okay, it will look nicer, whatever. The other does, really affecting a sense of self-worth, his sense of self-worth, has some now problems, low self-esteem, etc. But both are pure aesthetic medical indications. Is there a difference between the two? And where does the person wanting to do this stand?
We've got 1 minute for the answer, please.
Huh? No, I'm taking up too much time. I want Prof to answer.
The question is about plastic surgery. Somebody wants plastic surgery, and if the one person has maybe some body image issues, and it will affect them mentally, and the other one, if they don't, they just want to look better.
Alright. Anyway, about plastic surgery. Now, as the question posed is that if you have a sort of, you're born with certain, you want to enhance your beauty, especially the ladies and so on. They might not get a marriage proposal and so on. So in that respect, it would be fine for you to do that. But then, as for the other, it's just for beautification, which has no relevance. It won't even help in her health or anything, but she wants to do. Remember, the Prophet ﷺ said that there are 2 things that you cannot, there will be a cure for everything, except two things, that is old age and death. So as we grow old, definitely our features, the skin and so on, is not firm anymore. So I don't think we should go to the extent, we must accept. And I remember Sayyidina Umar radiallahu ta'ala anhu, he had a mukabbir. He had a mukabbir, means someone who would remind him and tell him that, listen, O Umar, death, there is such a reality as death. So then he went on every time reminding him. He told a mukabbir, someone who to remind him. And then one day, Sayyidina Umar radiallahu ta'ala anhu, he said that don't do it anymore. So now he was a bit worried. Why? Why he told me not to do it? He told me every day that I must remind him about death. He said, I've got a grey hair, and now I know that death is going to come. Shukran.
We're actually out of time, even though we had a bit more time, but I want to quickly open up the camera once, but if you can answer maybe in 60 seconds, with regard to documentation and sort of spurious signals, general practitioners often get requests from people, I missed my test, missed my exam, I was on holiday, I was in Umrah, I need a sick note. Or for medical aid, I'm applying for the medical aid, please don't write that I've got a heart condition or something like that there. If you can, it's difficult. We can spend 60 minutes on it, but if you can just give us some advices on that and how do you navigate that in 60 seconds?
Bismillahirrahmanirrahim. Yeah, I think this would fall under the category of black and white. You know, we spoke about black and white and we have intermediate grey areas. But this is overt deception. For example, doing a sick note for someone who doesn't really require a sick note, and it could be your best friend or your best friend's son. This is, or your own children. This is so these certain principles, would be just morally wrong. And we don't need there's no Islamic ruling on it, we just know. The world knows it's not right. So I think in the brief 60 or 30-second answers, defrauding, we spoke about using other people's names on medical aids, and these are clear cut, and we cannot sanction these things, and no one will be sanctioned. And I just in closing, I know we've run out of time, and I thought it was a good culmination. This session achieved, I think, what Mohammed you wanted to achieve from the session is there are a few things. I think very importantly we understand that there are a lot of moral dilemmas, and as the world sort of trudges along and there's technological advances, there are more pressing questions to the ulama. But at least we've stimulated discussions around it rather than degenerating without any control measures, and we go unchecked in our practices as Muslim practitioners. So at least we've got something to hold us back and some discussions to have that tells us there's, alhamdulillah, a progress with regards to our consciousness of our deen. Secondly, the important thing is there's a difference between Islamic bioethics as a whole and fatwa seeking. Islamic bioethics as a whole is giving us its general guidelines, but most of the questions we get, as our esteemed Sheikh had mentioned, requires deliberation by a group of scholars who are jurists, but with the assistance of duly qualified specialists. And often we have this problem in our communities. A question is asked in a certain context to a mufti, and that fatwa is made general and am, as we say, which is not how a fatwa should work and a ruling should work. There should be a multidisciplinary team that made up of ulama, muftis, different speciality questions, and we get out solid answers. And I think this is the birth. This session would be a birth to something like that. And the important thing is that a lot of these questions are very individual questions. We spoke about abortion. You get a person who's asking for an abortion at 10 weeks, whether the ruh has entered the fetus at 10 weeks or at 120 days. They are very, very individual questions. Can we do an abortion for a child that is, or a fetus that is 10 weeks and has got a Down syndrome? These are very specific questions, and maybe as an IMA we could drop a bank of questions and get these answered. As Sheikh Asim said, we asked very good questions, and we will put it to a panel, inshallah, to get these answers out. Jazakallah khair.
Closing comments from Sheikh Asim, 60 seconds.
I got 2 minutes left. No.
2 minutes ago.
Alhamdulillah. No, it's been a very useful session. I hope it has been. I'd like to know first, has it been useful for you guys? Yeah? So, a number of things. So, and we come back to Professor Ebrahim's maxim, which is moral clarity and moral courage. Right? These are two guidelines. The recognition that the Sharia is nuanced, it is sophisticated, and it is probabilistic, almost in its entirety. It is probabilistic and not definitive. Therefore, the importance of being guided by principles that are non-negotiable, those virtuous character traits. and avoiding the detrimental practices like lying, deceit, greed, and so forth. This is why that muhasabah, as doctors, it is incredibly important that you engage in that process of muhasabah, that you look at yourself in the mirror. Sayyidina Umar, since Sayyidina Umar was mentioned, Sayyidina Umar said, حَاسِبُوا أَنفُسَكُمْ حِسَابًا شَدِيدًا قَبْلَ أَن تُحَاسَبُوا. That bring yourself to account. Bring yourself strongly to account before you are brought to account. Be your own judge and jury before you are put before the judge and the jury. As medical practitioners, this is hugely important for us to do, whilst recognizing that there are a sophisticated framework of legal, ethical maxims that undergird the Islamic rulings where this is concerned. Lastly, I think my advice is this. Do recognize that that water takes on the color and the shape of the container in which it is contained. We exist in a context. We receive secular medical training. We exist in a world of secular ethics. And I'm not going to get into the philosophies of Islamic finances and so forth now, but there is a deep philosophy that underlies the medicine that we have all trained and practiced. There is a deep philosophy that underlies the financial system that we have all trained and that we all exist in and operate in. Please do bear in mind that the underlying assumptions behind those philosophies may not concord with Islamic philosophy. And hence it is important to understand the philosophical basis of Islam. Al-khayr, khayr al-akhirah. As Maulana Yusuf said, وَالْآخِرَةُ خَيْرٌ وَأَبَقَى. The next world is not only better, it also is eternal. And that the good of the akhirah, of your own akhirah, the akhirah of your patients is better than whatever is decreed for them in this world. So recognize that the financial system that you operate in is a system of takathur. It is a system of building up more and more and more wealth. Whereas the Islamic system of finances is one of infaq. It is of sharing and spreading and distributing wealth. Recognize that the principle, the fundamental principle of medical ethics or of medicine is the healing of the machine of the body, is the prevention of the pathology to the machine of the body, whereas the principle from an Islamic perspective is that of afiyah, which is of a state of well-being in this world and the next. So bear those in mind at the end, inshallah. Barakallahu fikum wa akhiru da'wana. Alhamdulillahi rabbil alamin. Wa sallallahu ala sayyidina Muhammad kama tuhibbu wa tarda.
Professor Ebrahim, 60 seconds closing comments. Okay. So just to close the session, obviously we received a lot of questions. We couldn't get through everything. As Zahir mentioned, that he put it on the chat, that I think there's a time now has come for the Master Faculty of Fiqh and Bioethics. And if anybody's interested, maybe chat with Zahir. We can get that faculty wing, obviously led by Professor Ebrahim, who's done a lot of work on bioethics. We haven't touched on all the bioethical issues because a lot of them have been discussed. Yusuf Ameer spoke about termination of pregnancy at the last convention in Durban. He did a full session on it. He's speaking about the fiqh of medication at the spiritual session to follow this. So just some housekeeping. We've got 20 minutes for tea. We're going to start our next sessions at 11 promptly. There's the breakaway sessions now. So the dental sessions will be in Maharani, which is, you have to go down to the ground floor, walk the road to Maharani, and it's in the Sky Venue on the 31st floor. The students will be on the second floor of Maharani, which is called Together. The other breakaways are, one is here, is Medical One, and then the other two will be across the corridor here. Jazakallah khair, thanks so much. Assalamu alaikum wa rahmatullahi wa barakatuh.